In the car accident we just saw, someone may have only minutes to live. If you were first on scene, would you know how to help? And would you be able to stop life-threatening bleeding? Hi, and welcome to today's bleeding control course. Over the next hour or so, we're going to learn simple and effective ways to stop life-threatening bleeding. These are skills that nearly anyone can learn and may be the difference between a life saved and a life lost. To be able to do this effectively, we're going to cover a number of topics. The string of survival, recognizing life-threatening bleeding, treatments for different areas of the body, applying common tourniquets, and packing a bleeding wound. "3 minutes. That's how fast a person can bleed to death. That's usually less time than it will take for an ambulance or first responders to arrive. Your ability to recognize and treat life-threatening bleeding will increase the person's chances of survival. To help guide you through this stressful situation, you can use the string of survival. Let's take a look. First, call for help. Phone 911 or tell someone else to. The sooner help is on its way, the more likely the person is to survive. Next, personal safety. Ensure the scene is safe and you're wearing gloves if they're available. If you're exposed to blood or any other bodily fluid, let EMS know when they arrive. Now, find the injury. Find the source of bleeding and determine the best way to stop it. Last, stop the bleed. Apply pressure, use a tourniquet, pack the wound. The string of survival will help improve the outcome. Life-threatening injuries can happen at home, in the car, at work, or in public places, and can be the result of injuries or deliberate attacks. So what exactly is life-threatening bleeding? It can present in a number of different ways. When you're approaching an injured person, look for bleeding that is spurting or flowing very quickly, soaked into clothing, pooling on the ground, blood is present and the person is confused or unconscious, or a limb is partially or completely amputated. To address these bleeding scenarios, we're going to cover injuries to 3 parts of the body: the limbs, the joints, and the torso. When you're approaching an event that's likely to have injured people, it's time for the string of survival to take over. The first thing you should do is call for help. Call for help verbally, alerting other people around you that there are injured people that need assistance. At the same time, you or someone else should be calling 911. The sooner you do this, the faster first responders will arrive. Remember the second step in the string of survival. Be aware of your personal safety. Survey the area around the injured person and make sure it's safe to provide aid. If the situation becomes unsafe, remove yourself from the area and, if possible, take the injured person with you. However, don't move any injured person without being directed to do so by emergency personnel. Once your personal safety has been secured and life-threatening bleeding has been identified, it's time to apply direct pressure with your hands to the wound. Most bleeding can be stopped or significantly slowed initially with direct pressure. Consistent pressure is difficult to apply for an extended period of time. For this reason, having appropriate medical equipment will make stopping life-threatening bleeding easier. If a medical kit hasn't already been located, instruct someone to do so. Advise that there may be a bleeding control kit located inside of or near an AED cabinet. At minimum, a bleeding control kit should contain gloves for your protection, a tourniquet, and material to pack a wound. Let's look at the sources of bleeding that are the easiest to control: the limbs, or the arms and legs. Bleeding from an arm or a leg can be quickly controlled by applying a tourniquet. You should follow guidance from your local medical authority to determine if and where you should apply a tourniquet in relation to the wound. The two generally accepted guidelines are to apply the tourniquet 2 to 3 inches above the wound or to apply it as high as possible, closest to the shoulder and groin. Some situations may make applying the tourniquet 2 to 3 inches above the wound difficult. For example, low light, clothing that makes the wound hard to locate, or a significant amount of blood covering the limb. For this reason, applying the tourniquet as high as possible is a widely accepted technique and what we'll practice throughout this video. If you're asking yourself if a tourniquet is the right thing to do, then it is. Tourniquets have been left in place for hours without causing additional harm. If the injured person is conscious, explain to them what you're doing and make sure they understand that the tourniquet may cause them additional pain. Understanding that the tourniquet will save his or her life may reduce their anxiety about what's happening. Also, once EMS arrives, they may receive something to reduce the pain. The two types of tourniquets we'll cover today are the windlass and the elastic type. The different parts of the windlass tourniquet are the base, the constricting band, the windlass rod, and the securing clip. First, slide the tourniquet onto the injured limb, situating it as high as possible above the wound. Next, pull the loose end back on itself and fasten it around the limb. Avoid covering the securing clip. The band should be snug but not tight. If you can slip your fingers under the band easily, then tighten and re-secure. Now, twist the rod until the bleeding has stopped. Finally, secure the rod inside one of the clips to lock it in place. Make sure the bleeding has stopped. Most tourniquets have a place to write the time of application. This will help prioritize patients in an emergency situation. It's good practice to look at the tourniquet frequently to ensure that it hasn't come loose and the bleeding is still controlled. Now, let's take a look at the elastic style tourniquet. Quickly open the package and remove the tourniquet. Inside the package is a wristband for recording the time. Set this aside. You can support the person's limb between your legs to make passing the tourniquet easier. Begin wrapping the tourniquet around the injured limb, once again situating it high and tight. The first wrap doesn't need to be tight, but should be snug. As you're wrapping, be sure the material is tight around the limb, with each wrap getting progressively tighter. When there's only enough material left for one more wrap, slide your fingers under the elastic band so that you can easily tuck the end underneath, ensuring it's secure. Once the bleeding is stopped, place the time wristband on the patient's wrist and record the time. Once a tourniquet is applied, it shouldn't be removed unless it's by a skilled medical professional. Now, let's pause here and practice what we've learned. Try applying both types of tourniquets to yourself and someone else, both to an arm and a leg. If you have any medical conditions or concerns, inform the instructor and refrain from having a tourniquet applied to you. As we've learned so far, tourniquets can be a safe and effective way to stop life-threatening bleeding coming from an arm or a leg. Next, we'll look at injuries in the area of the shoulders and groin. Bleeding from these areas can be stopped by applying direct pressure or by packing material into the wound. Bleeding from the shoulder or groin can be more difficult to stop because the actual source of bleeding can be hard to identify. Wound packing material may come from hemostatic product, gauze, clothing, or any clean material that is available. A hemostatic agent is a material or substance that either creates an artificial clot or helps speed up the body's natural clotting process. Regardless of what type of material you use, the technique is the same. First, apply direct pressure to the area of the wound using either your hands or a knee. If another person is present, they can apply direct pressure while you open the wound packing material. Open the wound packing material and locate the end. Gather a small amount of material around your finger and push the material deep into the wound towards the source of bleeding. Maintain pressure with your first finger while you prepare more material with the other hand. Now, push the other material into the wound, trying to maintain constant pressure. Repeat this process until you've used all of the material or the wound cavity is completely full. Once the wound is full of material, lay the remaining material on top of the wound and apply direct pressure with your hands for 3 to 5 minutes or as long as it takes for the bleeding to stop. While you can pack a wound with whatever material is available, having a hemostatic agent can provide a better chance of stopping the bleeding. Make sure you focus on proper technique during your practice. Ensure the wound packing material makes its way to the source of the bleeding. If the material is only placed at the opening of the wound, the person will continue to bleed. Now, let's pause here and practice. If you have any questions, ask your instructor for a more detailed demonstration. Learning to apply a tourniquet and pack a wound will go a long way towards saving a life. These are skills that you can easily practice even after leaving this course. Make sure you talk to your instructor about what might be an appropriate medical kit for you. Lastly, how do we address major bleeding coming from the abdomen, chest, or back? The only thing that can help a person with a major injury to one of these areas is getting them to a hospital. Once emergency medical services arrive, let them know about these injuries right away. If it's not possible for EMS to get to you, consider transporting the injured person to the hospital, if it can be done without further injury to the person or yourself. Do not do anything that may harm the injured person or may be against local laws. Aside from controlling major bleeding, covering the injured person with a blanket of some kind will help out in multiple ways. Body temperature is a key factor in the body's ability to stop bleeding. Losing blood rapidly lowers your body temperature, and the lower your body temperature falls, the harder it is for the body to stop bleeding. Let's recap what we've learned today before continuing with your hands-on practice. Once you've identified or suspect that someone may be seriously injured, call for help and contact 911 as soon as possible. Waiting may lessen the injured person's chances of survival. Remember that your personal safety should be your primary concern when rendering aid to an injured person. Protect yourself with gloves if possible and ensure the area is safe. This can mean a number of things, from unplugging dangerous electrical equipment to ensuring a dangerous person has left the area. Finding any life-threatening bleeding should be your main focus and can present in a number of ways. Spurting or flowing very quickly, soaked into clothing, pooling on the ground, blood is present and the person is confused or loses consciousness, or a limb is partially or completely amputated. Once you've identified life-threatening bleeding, apply the appropriate intervention. Most bleeding can initially be controlled with direct pressure. After direct pressure has been applied, bleeding from an arm or leg can be controlled by applying a tourniquet. Depending on the circumstances, a tourniquet should be applied 2 to 3 inches above the wound, or as high as possible, close to the shoulder or groin. A wound in the area of the shoulder and groin can be controlled by packing the wound with a hemostatic agent, gauze, or any other clean material. Injuries to the torso need a higher level of care and should be pointed out to EMS right away. Additionally, you can talk to the injured person and let them know what you're doing. Reassure them that you're doing everything you can for them. Lastly, if available, cover the injured person with a blanket or additional clothing. This will provide them comfort and also help to maintain their body temperature. Now that you've attended this course, it's important that you continue to educate and equip yourself. Talk to your instructor and do your own research to find out what your local Good Samaritan laws are. I want to thank you for your interest, time, and attention today. Hopefully, after today's course, you feel better prepared to stop life-threatening bleeding. These are skills that might make the difference between a life saved and a life lost for you, your family, or someone in your community.